Okay, welcome to What the Flip podcast. I'm your host, Victor Vogel. We're going to be covering a topic this evening on healthcare. Talks a little bit about the disparity in the system. Now, remember, just to kind of recap on each one of these, I talked about we're spending probably more than anybody else in the healthcare system world out there. We're the only one that has a high private segment of our expense. That's part of our expense program for healthcare. And we also have a government portion like other countries do. And with that government portion, we're pretty much in line. It's that private segment that costs us so much more money than everyone else. And we compared that against the OECD organizations, or those countries that are democratic and also operate in a free economy. And we found out that we don't rank as well as those other companies in overall expenses, and we also don't end up receiving as much money or as much for the money we pay. So then we took a look at where that spending happened, and we come to the conclusion, looking at this study, that basically the largest portion of healthcare costs, the spending, the largest cost associated with the spending, is in the hospitalizations and how they're run and how they're managed, and the professional services. And we found in the following segment from that one that that people are basically divided into categories of the percentiles of spending. And as you might suspect, the older category tends to cost or spend more on healthcare than, say, younger age people, but not necessarily. We also learned that is hard to measure because there's a randomness to healthcare. In other words, you can be young and have an very expensive one-time adventure in a year, maybe $100,000 or more, that could put you in the category of being an ongoing healthcare cost at a high level. Say you were diagnosed with cancer and you had to sustain treatment for the rest of your life, or let's say you were in a car wreck and it cost you and you had to have rehabilitation over years. So those, it's kind of hard with our system to figure out where the cost is, but generally speaking, for the vast majority, there's for those people who are in the 99 to 100 percentile and 90 to 100 percentile category, are normally older folks, and normally because their health care is sustained over a period of time. So that kind of catches you up where we are. The next question becomes, where is healthcare happening in terms of the United States, in terms of cost, when you consider all those things that I just mentioned? Okay, and that's sort of what we're going to cover today, and I'll just skip right to it. We'll just share my screen with you right off the bat here. And let me sort of cover this as we go with it. First of all, we want to just take a look at this first paragraph of the study, where it says some places in the United States have considerably higher healthcare spending than others. And this is not primarily a matter of elderly people being disproportionately represented in certain areas. We'll go down here and show you this figure, but figure 6 shows spending per privately insured beneficiary after adjusting for differences across places in age and sex. And the upper Midwest and much of the East Coast and Northern California are notable as places with specifically higher spending. So let's look at that. So it's not as if, we look here, we see from this category here, uh, spending in 2011 dollars. This is an older study, but I think it probably still holds pretty much true today, except up until 2020, where the pandemic has just basically obliterated this whole thing from the standpoint of costs. But we do notice that there's more, even in the pandemic, there's a lot more spread in these areas that are in darker colors, which represent higher spending. You see them here in Texas. We know that's pretty much true from the pandemic. California is the same way. Uh, Florida may be a little more costly right now. But notice here in this back in 2011, they have a large high age population, but their spending wasn't as much as Georgia and up in the Carolinas and the northeastern coastline and the upper Midwest and over here in the California area. So that's what this is saying. You can't just go by age category. There's something else about this spending we need to understand. So, in comparison of the so-called referral regions, regional healthcare markets, spending per privately insured beneficiaries is about 3 times higher in the highest spending regions, those that are, for example, Anchorage, Alaska, than in the lowest spending regions, which are like Honolulu, for example. Roughly half of the overall variation is associated with differences in prices across the region. And this is what I've been pushing at this whole time. It's the management of these hospitals and the management of these professional services. And even the drug prices vary across all regions. So variations associated with regional prices across regions, with the other half due to differences in the quantity of healthcare consumed. Surprisingly, a significant amount of the national variation in prices occurs within hospitals. Now, see, that's not a surprise to me because I have been looking at this for so long, and there's so many other reference points that point to this issue that where you get your hospital cost or where you are treated for your healthcare makes a large difference in terms of the cost you're going to have associated with it, and that has a lot to do with how hospitals are run. For example, here's how this would work: if you are treated into a conglomerate hospital, a group, in other words, a hospital group that owns many hospitals, many of those, in order to sustain the cost, for example, of renting facilities or building facilities and running and living in, say, the northeastern area like New York City or San Francisco or someplace like that, these living costs and the cost of operating, just like other businesses, are so much more that the average cost for private people to pay for insurance and what insurance pays plus what they pay out of pocket is so much more than, say, somebody living in Oklahoma or somebody living in Kentucky or Tennessee. And not quite sure why those upper Northwest areas are so high in terms of this, but they are. And that might have to do with the frequency that people are involved in being hospitalized in these areas also. It could be the numbers of people living in the area, the numbers of, say, minorities who are depressed and don't have the funds to eat well, and just a whole host of variables in there that can impact this. But what you notice is most of this has to do with hospitals and the cost of hospitals and how they're operated. Not even so much the professional services, although they vary also from place to place, but just the cost of hospitals and how they're run and where they're run. Okay, so let's just go down a little bit because there's some interesting points right in here. And remember, you got a lot. Look at these lighter areas throughout the middle of the country where the population is less dense. Okay, you begin to see a lot less expense associated with these. And a lot of these areas in here, like California, Florida, the Southwest, these are all retirement areas for people who live up here that don't want to put up with the cold anymore, or certainly don't want to move into the cold or isolated areas where they can't enjoy certain things they're looking for in their retirement years. So Medicare spending is somewhat different, however, and that's the government portion of our spending. It has to do with people who have reached 65 and can be placed on Medicare. Prices are set administratively rather than through decentralized negotiations between payers and providers. Most of the geographic variation in Medicare spending is accounted for by differences in healthcare utilization across places, especially in post-acute care, really serious stuff, rather than prices. So the variation in utilization is driven by demand side factors like health preferences, but differences in supplies across places are also important. So really what this is saying here is one of the differences is the ability of Medicare to negotiate prices for services, prices for products, prices for hospitalizations, and those kinds of things is a little bit better run than our private sector. Our private sectors have such disparity in how all that's negotiated. But if you come, and you could see how that would work. Let's go down here. Let me take us down here. You could see, somebody is talking about cost of goods, cost of real estate, all of the things it takes to do with a hospital up here. And so they throw all of that into their pricing, where the government says, hey, look, there's a set pricing we're going to accept across this whole country for anybody who's in Medicare. And if you want us to, if you want this person, if you want to accept Medicare, which is a large portion of a lot of doctors' businesses now, if you want to accept people, the largest portion of doctors' businesses are not with a lot of young people who go in and get a $75 annual, quick checkup, and that's it. And then they don't see them again for another year. A large portion of it is Medicare, and doctors understand this. And people have chosen not to stay with their private insurance when they turn 65. First of all, they can't. They retire. When they retire, their job is gone, and therefore their health care coverage is gone from an insurance perspective. So they have to go on Medicare. That's one thing. But if they don't retire at 65, they still have the option to go on Medicare. And many, many people choose Medicare because the cost is less across the country wherever you go. And it doesn't vary. If I leave Michigan up here where I am in Michigan and I go out to San Francisco to live, the cost of Medicare is not changing. The cost of my private supplemental plan to go with Medicare changes one hell of a lot. So that is the dynamic that's going on here. And what we find is that's driven by how hospitalizations are operated and how they do businesses with the doctors and other providers like laboratories and things like that. And this is also true about your pharmaceuticals. You literally can go in the city. I had one drug I was supposed to get in the city. I went to one pharmacy, it was $125. I went to another pharmacy and it was $16. Now, what drives that cost variance? It's the same drug. I get the same amount, the same potency. It, it has to do with how that pharmacy company is managed and run and what they're trying to do with the revenue that's generated from the sale of those drugs, and also how they negotiate with their providers. Medicare is pretty clear. This is what we're going to pay for this drug for these people, period. And we have the option of buying from the Medicare group pharmaceutical as one large grouping. So the pharmacies are sort of required to negotiate with us a little bit, or negotiate with the government who manages this. This has gotten to be such a problem that the private industries are trying to get Medicare to help them figure out how to do this more effectively. But yet people are saying they want to keep this private insurance. They do not understand what they say they want to keep. So in this spending variation, evidence of a problem policy should address, is this spending variation evidence of whether of a problem that policy should address? The answer and the policy response, if one is called for, depends on whether spending is especially high in some places because of insufficient competition and related marketing. I can tell you now, we know that's true across the country. Everybody is going, we'll create these competitive. You only have a few insurance companies that dominate the whole market. And you only have a few major hospital chains out there who are grabbing up and bringing into their organization all the other small hospitals who are struggling to operate. Okay, that's why you see a lot of hospitals moving towards urban areas because they can charge more in those urban areas. And consequently, rural hospitals are left pretty much to stand on their own, which is not very comfortable because they don't have the funds and people who live in those areas normally are not the people who can afford to pay the higher prices because they have lower wages, whatever that might be. You earn a lot more normally for the same job in New York that you do in Peoria, Illinois. It's one of these things that is a function of our capitalistic society. And what happens is that healthcare has been sucked into that. And because of that, they're operating like that. And you see all these varying differences, just even within health insurance premiums. The difference between what I can be offered, not just the premium, but what I can be offered, and also the premium varied when I moved 20 miles from where I was in one place to the next place. I could not, if I had just moved and not contacted my insurance company, I might have been without insurance because I was in a different county. So consequently, it's county by county they assess this. So if I moved 20 miles from one place to another and I change counties, I have to change my whole insurance program to do that. I do not have to do that under Medicare, but for that supplemental plan that I buy to cover what Medicare doesn't cover in the plan, then I have to pay that varying difference, and also what is covered. And not only that, it's all very, very complicated. It's very complicated. So it's kind of one of those things where you're trying to figure out what in the world is going on here with all of this. Why is the expense so high? The expenses are higher in some places than a lot of others. And you have a lot of people in this Midwestern part or the middle part of the United States going, we're not experiencing a lot of this high expense income, but they are also a minority of the number of people in this country. Most of the people in this country live on the East Coast or the West Coast or in this upper middle region or southern region. They don't live in the middle of the country in these states over here. So consequently, your insurance is so much higher, so much higher in these areas than other areas. So that's what I wanted to explain to you this evening. That, now we know we have more cost than ever. Why we have more cost than ever has to do not so much with whether you're older or younger. It does have to do with your health level, which we looked at. You're excellent to really poor. It does have something to do with that, but primarily that cost for all of those people is more in line with what hospitals and professional services are charging them and how they're billing us. I'm telling you, I don't think you will get a straight answer as to how much something will be charged. They give you, for example, I just got a dental pre-assessment for dental work. When I break that down, if I go in and look at them, I'm trying to say, how much of this is for pulling a single tooth? Okay, a single tooth. How much it is wrapped up in the actual partial? How much does the dentist charge for what they do, and how much does that lab service charge for making my partial? I'd like a breakdown. You can't get all of that. You can't get that breakdown. They provide it to you in conglomerate pieces. It's going to cost you $1,200. Well, why? Why does it cost me $1,200? Would it cost me $1,200 in Oklahoma? Would it be worth my money to get in a car and drive down to Oklahoma and have this done? See, so that stuff that's going on that us, private insurance companies, it's even harder than me, because at least I can go to the government and I feel fairly comfortable. The government's negotiated a price that they're going to pay from a Medicare standpoint all across the country. As a private insurance person, that one thing you really love to be on, you don't want to give up, you can't do that. You would, it'd be crazy. Yeah. But if you're going to keep your private insurance, you damn well better take the time to ask the question before you transfer from one place to other, how much more your insurance is going to be cost, and is there going to be a coverage difference? Okay, because you're going to find some differences. I found it in my car insurance. And so it's not just healthcare, it's how insurance companies run and how the businesses associated with them run. And go try to figure out how in the hell they figure the insurance prices on cars you rent for a day if you cover yourself under insurance that way. You can't figure that out. But I mean, I went from like $90 a month for my car insurance to $300 going from Oklahoma to Michigan. Why? Because the way they run Michigan insurance is so much different than the rest of the country. Actually, Michigan is the highest insurance for cars in the country. But it's how each of these run, and it's different between all of them. It's different in direct pricing. It's different in services for lab tests. It's different in the hospital, what they charge for the bed for each hospital per section, even, for whether it's more complicated or just an overnight stay for something. It's just varying prices that are so complex and so confusing that it takes a monolith of an organization manage, track, and control all this. And that's why much of it falls through the cracks, because they're not very good at it. They're not very good at it. Where other countries, you don't have a lot of this pricing and everything. They're kind of like Medicare across the board. So, if you could have everything you have coverage-wise, think about this. If you could have everything you had coverage-wise in a Medicare program, including, I don't know if you get the exact doctor you want, but you get a competent doctor, somebody who could do what this other doctor you've been going to for a while has done if he doesn't want to get on Medicare. But I'm telling you, if everybody in the country pretty much went that direction, that doctor that you have now will be in the Medicare program. You could select him. He would say, yeah, I want to take Medicare. It's a real kind of fallacy about you can't select who you want to select and all that kind of stuff. So this is, now you're beginning to see the real dilemma with our healthcare system, why it's such a wreck. Not only is it more expensive than anybody else, we are the major people who are paying for that, or I guess I'm not so much now, I'm on Medicare, but you, if you're in private insurance, are the one that's suffering the most from high hospitalizations, high professional care services, high cost insurance companies. And now you know that it's not just the older people, everybody is paying this. So even the younger people are having to shoulder so much more money than they need to out of their paycheck to make insurance companies solvent so they can insure you, where Medicare just does it across the country. Bang, there's no variance, there's no differences. Everybody gets charged the same rate for this service and just about everywhere. Maybe some variances or something, but they're not many and they're not much because they're not running a for-profit business. They're not running a for-profit business. And I know I'm for free enterprise, and I want people to be able to earn livings and make money and hire people, all that. But I'm not for everybody being ripped because of that. I'm not for people. I'm not for that system for our healthcare system. I'm not for that system for other things that really don't fit the model of capitalizing. Okay, they don't fit the model. It just doesn't work because greed begins to take control, and then people lose out in the picture. Healthcare is about taking care of people. It's not about making as much money as you can off of it. If you in some ways those are contradictory. So there you go. Now you begin to see more in depth what the real issues with our healthcare system are. Keep this in mind because you have a current party, the Republican Party, who just doesn't feel like we should ever move off of that private system, despite all the facts I provided you the last 5 plus this 6 fact session. These people know this stuff. They just don't want to disrupt it because their money comes into their campaigns from these corporations. It doesn't come from places that are non-profit organizations so much as it is the profit-centered organizations out there. So it's kind of like the Republicans are representing, and this is the dilemma that's causing the problem with the stimulus. The Republicans are representing that group that doesn't want to spend any more money, but wants to make sure corporation heads and corporations get what they need to run the business, assuming if they can run their business, that everybody will have a job and everybody will be happy. But what we've seen is that created that large financial disparity between the poor and the rich. Right now, There are a lot of people getting rich in this pandemic area. There are lots more people suffering. But did you get there has been a bill in Congress since May 20th. May 20th, folks. The bill has been on the table. There was no reason for anyone to suffer except the wrong call. We think this will die out and business will come back. They were told it was wrong. It's been proven to be wrong. It's even worse than it was back in April. Now, at what point do they wake up to reality and quit relying on this broken philosophy they have? It's a broken economic philosophy. And it's been proven time and that's what drove us into 2008 recession, was greed based on the trickle-down program. Then we tried to do the trickle-down program after we came out of the recession. We're going to do the trickle-down program. And in 4 years, it hasn't done anything for us. It's driven us in the wrong direction. Except there were a lot of, if you measure the success of the economy by the stock market, then yeah, we were doing great. The problem is the stock market is not the measure of the welfare of the country from a financial perspective, because the vast majority of this country was not benefiting from all the money made by all these other organizations at the top. We had a businessman, a crooked businessman at that, but a businessman at the top, trying to put together a government that supported that program. And it was failing constantly. And then when the pandemic hit, it really blew up and you saw the whole picture fail. So that's why we really need to come together as Republicans and Democrats and begin to see the reality of things and not just try to push some sort of an agenda, And Democrats need to do this too. What happens is if you get to talking about what's right for the whole country, and your two different points of view, what you normally come up with through synergy and talking through things is something that's better than both of those parties would have benefited from for the whole country. Now, I think we have a guy in there that's going to try to do that. But, if you have people like Mitch McConnell and these other Republicans out there like Rubio and the guy from Texas, I can't even think of his name now, they're all standing up saying, no, and Rand, he's an idiot. How can you do this? Okay. This is a guy who refuted Fauci and all the scientists through the whole thing. Every time he had a hearing, every time it was getting worse, like they said, he kept saying it wasn't. It was like, and he's a doctor. How can you figure that out? Is it not a doctor I would want to go to? He's one of the doctors who wants to make money off of people, not help people. So there you go. You have a great evening. I hope you had a good Thanksgiving. Please, over and over again, wear your mask. Stay socially distanced. Don't go to bars. Don't go out to most of these are being shut down. But if the bar isn't shutting down and they allow you in there, please don't go. Please don't go, because you are just going to make Christmas miserable for other people. We're about to see the impact 1 week before Christmas of what all this travel for Thanksgiving is doing to us. The scientists who projected this where we are now were right back in July. They were right in the latter part of April about May, July, school openings, and the upsurge in the flu season of the fall and winter. They have been right every single time. Congress has not been right. The government under President Trump was not right. They were wrong in all of these issues. But they operate in this insane denial arena, and it's just unfathomable they can think this way. So there you go. So please wear your mask, stay at home for the next month or so. I know it's tough. It was tough for our family. It's tough for everybody, but you've got to do this. You really need to pay attention to what the information is saying and stay away from conspiracy theories and stay focused on facts, information that's been validated and verified, not information people just throw out there and say, here it is. This is stuff you can go look at, check it out for yourself, and it proves facts. Then pay attention to it. That's what science is about. That's why we need to drive this by science. All right. So I do hope you do this, and I hope because you do this that we're going to have a great Christmas in the upcoming Christmas period. Maybe I don't know that we'll be able to, not travel again, but at least we would have some hope that this vaccine will be out and we'll begin to see that spread sometime in the spring. And hopefully, if we really buckle down and do well, we might be able, starting in April, May, to begin to enjoy our life again a little bit. If you don't do what you're supposed to do now, chalk that up. The science is telling you if you don't, you're not going to be there in April, May, June. It's just that simple. It's happened every time. So, it's up to you guys. We're doing it. It's up to you guys. Have a good day. I'll see you next time. We'll cover one more segment about this healthcare program next Monday. Thanks for watching.